Hello everybody, welcome to Furry Friday. I cannot believe it's Friday already. This week has just like flown by. So I'm sure you can tell by the little title, wherever it is. Today we're going to be talking about whether we are spaying and neutering our pets too young. So this is kind of something that I have gone through myself, so I kind of wanted to speak to it. Hello Catherine, how are you? Before I jump into that, Facebook always likes to show our lives like 10 minutes after we start them. So I'm just gonna give a little like brief where spay and neuter kind of came from. This is not, hi Paul, hi anyone else I do not see. I'm sorry if I don't say hi to you, I'm just blind all the time. So how this started is, it was early 1970s actually. We were keeping our dogs very differently. If we think of the way we're keeping our pets, we kind of just, they came and went as they wanted to. They'd sleep inside some nights, they'd sleep outside some nights. They weren't like strictly indoor dogs, they weren't strictly outdoor dogs. They just did their thing for majority of the time. And lots of these dogs were not spayed and neutered. So there was lots of little puppies running around from accidental litters. And unfortunately, the shelters got very overwhelmed. And I think there was an insane numbers, like I think for every 100 people there was 10 stray dogs or something like that. Insane numbers of strays. So something had to be done, and what better way to prevent accidental litters than preventing dogs from breeding? It makes sense. So that's where the spay and neuter came in. If we think about now, I would say we keep our dogs majority of the time quite differently than we did back then. I always kind of know where my dog is, like the general area she is. And if you talk to most puppy owners, if you have a puppy that isn't spayed or neutered, you know to keep them away from other puppies that are not spayed or neutered. So we've kind of changed the way that we keep our dogs to prevent those accidental litters. However, we haven't changed really the age that we're spaying and neutering. So then all these vets were like, hey guys, I'm starting to notice this correlation. Like all these dogs are coming in with these joint problems and like hip dysplasia, and they were the ones that were neutered or spayed quite young. But then intact dogs come in and they look great. So this is kind of where all these studies started from. If you want, we can like cite all our resources if you would like. I do have to preface this by saying I'm not a vet, so I cannot give you direct knowledge on like, hey, when I'm in surgery, I know this because of experience. I don't do surgeries. I don't do spays or neuters. I've never been to vet school. However, the beauty of where I live is that I have access to scholarly articles and research papers, and I can read them. So what we've done is we've compiled that information, and I just wanted to kind of regurgitate it in a very easy to understand way, so you don't have to spend hours reading research papers. So that's kind of my little starting thing. I can cite all my sources if you would like. I'm trying to do this as non-biased as possible. If I'm gonna include my opinion, I'll say where my opinion is. So we might as well jump right into it. I do wanna start with the benefits of spay and neuter because I have a dog and I have a family dog, and they're both spayed and neutered. So I do believe in the benefits of it. For my personal self, that was the best choice for me and my dogs. So there's obviously pros to spay and neuter, but what we're gonna go over is the cons to that premature spay and neuter. So to start with the pros, there's no chance of an accidental litter of puppies. If your dog doesn't have a reproductive system, they cannot reproduce. Very simple. There's no chance of testicular cancer. If your dog does not have testes, they cannot have testicular cancer. There's also no chance of a pyometra. So pyometras are in female dogs. They're essentially like an infection in the uterus. It's like a little pus-filled pocket, and if it bursts, that is of course a problem. Reduced chance of benign prostate hyperplasia. So essentially, this is a non-cancerous swelling of the prostate gland in dogs. Non-cancerous, still painful, can be treated, but it's not cancerous. And there's a reduced chance of that. Then there's also a reduced chance of mammary cancer in female dogs, because we don't have those hormones stimulating those mammary glands. Kind of cool thing. So those are your benefits of a spay and neuter. I'd say the pros of a traditional spay or neuter are more so what you talk about with your vet, because they're going to be more related to surgery, to recovery, those types of things. the cons, did I say cons? Yeah, the cons. The cons of a traditional spay neuter is related to surgery. But the cons of a pediatric thing is something that, yes, we can talk about. Talk to your vet about it, the actual surgery side of things. So now that we're talking about pros, we do want to also look at the chance of these things happening. Because if I'm reducing the chance of testicular cancer and there's like 0% chance of it, and that's my main reason for spaying neutering, probably not a good reason to spay or neuter. So here we go, I have it written down. Okay, so in an unaltered adult male dog, there is less than 1% chance of them developing testicular cancer, and then the chance of them developing the prostate hyperplasia is less than 0.35, and it is treatable. So those guys are not big concerns. They're not a reason to spay or neuter, but they're a little benefit. Most of the diseases that are reduced by your spay or neuter are ones that are reduced because you're removing that organ, right? So lots of them, they don't have a high instance of occurring in the first place, but there are some that are worth talking about. So pyometras and mammary cancers in female dogs can be life-threatening if they do contract them. And depending on how early you catch them or how late you catch them, they can be life-threatening. So they are not to be taken lightly. 1 in 4 unaltered female dogs will develop a pyometra, and they will have to get their uterus removed, which is essentially a spay. Where do we go? Mammary tumors affect 26% of unaltered female dogs. 50% are non-cancerous, 50% are cancerous. So there are higher risks with female dogs that are unaltered. So it is worth talking about and knowing the risks and the cons and all those things. So those are kind of your benefits and like the instances of them happening in the first place. That's very basic stuff. But the topic of the live is not about that. It is about those pediatric spays and neuters. So when I talk about pediatric spays and neuters, I'm not talking about a dog, like 1 month is not considered, it is considered pediatric, but that's not where the line is drawn. Most dogs are hormonally mature and their growth plates are fused by 2 years old. So that's usually kind of the line, is that 2 years is when we consider them mature. So smaller dogs, it's less, it's like 17 months. Bigger dogs, it's closer to that like 24, 30 months when they are mature. So anything before that is what is considered a pediatric spay or neuter. So now we're gonna talk about the cons of those. These all come, I'm gonna list them off, they all come from actual research. If you want our sources, we can cite them. We can do that, but I'm not gonna type them all out if nobody needs them. Okay, so pediatric spays and neuters have been linked to multiple things. First thing that vets wanted to check out was the joint disorders that we're seeing. So dogs that are pediatrically spayed or neutered do not develop normal bone mass or density. This results in smaller bone size, as well as greater incidence of bone cancer, fracture, and hip dysplasia. So best way to explain this is if you picture your arm as like the front leg of your dog. This is gonna be simple math. It's not actually correct, but this is to explain it. If we think about this bone, let's say it is completely grown and starts to fuse at 6 months. However, here to here starts at 18 months. If we're spaying our dog at that 7, 8 months, this bone is completely grown. This one has not. So now we have a shorter bone here. We've decreased this angle here, and it's just not the way that they're meant to work. So now we're gonna get a whole lot of joint problems here and here because our dog isn't fully grown before we remove their growth hormones. So yes, there is issues with joint problems. There's also increased incidence of incontinence, so lower bladder control. This one is really kind of, it seems counterintuitive to what we're actually taught, but there's increased aggression, fearful behavior, and phobias with dogs that are spayed too early. So lots of times we see people wanting to spay and neuter their dogs, especially male dogs, to help those hormones and to help that kind of like crazy puppy stage. However, when we do that, we reduce it a bit, but we're also increasing those chances of aggression and phobias and fears and anxiety in the future. So definitely, if you're wanting to prevent those behavior things, do it after they've matured. So that is kind of the line there. Lots of people have done it really early to prevent those from happening, but it's actually been disproven. There is an increased risk of acute fatal pancreatitis, diabetes, and obesity. Obesity comes from after you've spayed and neutered your dogs, you feed them less because they don't need as many calories. There's increased incidence of infectious disease and autoimmune disorders. There's increased risk of developing cancer of the heart and spleen and urinary tract infections. There is a tripled risk of hypothyroidism, quadrupled risk of prostate cancer, and there's a decreased cognitive ability. So these are all the cons that come with those pediatric spays and neuters. So how do we combat this? How do we get the best of both worlds? We spay them after they're hormonally mature. So these are actually, I have pulled this from our puppy guide that will be coming out soon, which is also going to have a little chart that you can read. Essentially, University of California did this study. It was a 15-year-long study on 35 different dog breeds on when they should be spayed or neutered based on their breed. So it's really cool because some of them, there's no increased risk or decreased risk when you neuter them. Some of them say after 6 months, some say after 11, some say after 24. Really, really cool article to check out. We can link that. It is also in our puppy guide that is coming out soon. So best way to do that is to spay or neuter your dogs after they have really reached that level of maturity. So how do we know when dogs have reached their level of maturity? Either by age, we can definitely do that. Female dogs are a lot easier. We usually say once they've had their first heat or two, they're hormonally mature. So depending on your dog, that could happen at 6 months, that could happen at 14 months, but that's kind of how we work that. For myself, Rue, I decided I wanted her to go through a heat or two before she got her spay to make sure she was hormonally mature and to prevent all these future problems. Not to say they won't happen, there's just a decreased risk. And I thought she was gonna have her first heat around 10 months. She had it around 7. So she had her first heat. Then I made her go through another one, which is honestly not a big deal for most dogs. And then we had her spay or neuter. So main thing to take away from this is that when we take away these vital growth hormones in a growing animal, it has negative effects. That's as simple as it can be. We need those hormones for the dogs to grow. We need them for cognitive abilities. We need lots of things. Not to say you shouldn't spay or neuter your dog, just do it responsibly. So that's kind of the basics of that. Another thing you can address with your vet is different types of spays and neuters that keep those hormones. So there are ovary sparing spays, which keep the ovaries for female dogs, but take out the uterus so that they cannot have babies, but they still have the hormones. For males, it's kind of like they can do just a little snip where they snip the vas deferens. They still get to keep their testes for their hormones, but they cannot actually reproduce. So those are really good options as well. Of course, address those with your vet. They are able to give you more direct answers on which would be suitable for your dog. But the main takeaway here is the age that we're doing these spays and neuters, and that is something that we have to look at and be aware of. So please take this information how you will, but the main takeaway from this is we need to stop spaying and neutering dogs that are young and still growing and are still babies. Once they're hormonally mature, we can definitely do that if that's what you're wanting. So that's kind of the big takeaway. Obviously discuss with your vet what you think would be the best option for them, based on if you do a traditional spay or an ovary sparing spay, or if you do a traditional neuter or just a little snip neuter. So yeah, those are kind of your different options there, but I just wanted to present you guys with the cons that come along with those premature spays and neuters, because my senior dog is 11 years old and I did not have this information when we made that choice for her. So this is something that I wish I would have known of. I'm happy that I know now, and lots of vets are starting to implement this. So definitely is the new wave. I know it is a lot easier for us pet parents to spay them at 6 months, because then we don't have to worry about like puppies, or I know some doggy daycares don't let them in after 7 months if they aren't spayed or neutered, but you know, there's so many other things we can do with them, and these risks are just too great to risk. So yeah, I hope this was informational. If you guys have any questions, feel free to call us. If it's more surgery related, talk to your vet. Once again, we do not do surgeries here, so please talk to them. But that's kind of just the basics. We will be, if you have a puppy, we will be bringing out our puppy guide soon. I went over the 2 basic pages. I think there's 6 or 7 pages on spay or neuter. So if you do have a puppy, do watch out for that because it'll be a lot more in depth. So this was kind of just that surface level introductory course. Thank you for tuning in. Thanks for watching. If you have a friend who has a puppy, tag them down in the comments so they can watch this, so they can make an educated decision on what they want to do for their pup. But yeah, thank you for watching. I hope you guys stay warm. It's kind of nasty outside, but hopefully we have a great weekend. We are open tomorrow, 11 till 6. We are closed on Sunday, and then we're back on Monday. So take care. Bye.